Botox. It's so 2006. What are the latest breakthrough procedures to erase lines in your face or get rid of fat? We're going to look at the hottest new trends in plastic surgery.
You know, we're going to talk medicine for a second. One way to start the new year is with a new you. Plastic surgery up 20% around the new year. And joining us with the latest trends in plastic surgery is plastic surgeon Greg Wiener. Greg, good to have you back here. Good to have you.
Thank you.
So, busy time for you this year?
Very busy time.
What do you think that is?
Well, lots of new and exciting things coming around the corner. The first one is the silicone gel.
Yeah, you know, a lot of people are wondering whether, you know, when it comes to implants, whether this is the way to go. Now, what I have in my hand is the gel, and this is how you used to use it. Correct. Saline, right? Are these, is the gel safe?
The gels are absolutely safe. We have 10 years of good data on the gels.
Mm-hmm. Well, you can see there's a different thing. Why is the gel more popular?
Well, as you can see, the gel has a better consistency. It's definitely softer. It's more lifelike in the tissues than the saline is.
This is the saline, and this is the gel. All right.
Right.
Safe, and obviously people are turning to it more now. So well, that's, we're going to see one of the trends.
Absolutely.
Now let's talk about non-invasive surgeries, and you got some needles here.
Correct.
As an example.
Well, you know, people want a nice change without downtime, and that's why these are going to remain popular and increase in popularity. There's new injectables being developed all the time. We have Restylane, which is the most popular one, lasts about 6 months. Radiesse, which is also very popular.
How do they work exactly?
Well, basically, they go into the tissues, they're injected into the tissues, and they plump up the tissues. So
like Botox?
Well, Botox actually paralyzes muscles, so that does something a little bit different. These actually go underneath the wrinkle, plump up the wrinkle, and smooth things out.
All right, cool. So that's something else a lot of people are going to be asking about.
Absolutely.
What about the latest in lipo?
Well, the newest one out there is called Smart Lipo. It's actually a laser-assisted device that actually ruptures the fat cells, and then you remove those ruptured fat cells.
Oh, all right, and that's no problem with the safety issue there?
Well, it seems to be safe. It's used in smaller areas. It's become very popular for use in under the chin and the neck area because it also actually tightens the skin a little bit because it heats up the tissues from underneath.
You know, when we finish, I want to just go over the cost typically for all these things.
Okay.
But finally, let's talk about smoothing out wrinkles, what the options are out there.
Well, always a big topic. These are no substitute for a facelift, but they do actually have promise because they smooth out wrinkles without significant downtime. And another one called Titan have been around for a while. The new one is called Fraxel, and I think that holds big promise for smoothing out wrinkles without downtime.
All right, so let's review. The silicone implants, how much are they typically going for now?
Well, a silicone gel implantation will probably be somewhere between $7,000 or $8,000.
The Restylane and some of the other choices?
Restylane about $500 to $600. Radiesse, which lasts about a little bit longer, is going to be about $800 or $900.
Laser lipo?
Laser lipo, anywhere from a couple $1,000s to $4,000 or $5,000, depending on what's being treated.
And the last anti-wrinkle?
The last anti-wrinkle treatments, they go for about $1,200 to $1,500 a treatment, and you may need 4 or 5 treatments.
Okay, well there you go. If you're thinking about those stuff, hopefully you can get some answers there. But you can also go at myfoxchicago.com. We'll have a list of all of those for you to review. Dr. Wiener, good to have you here.
Thanks, David.
As always.
Good to be
Nancy,
here.
over to you.